My name is Dr. Habib, and I'm a pediatric endocrinologist, and I have been in practice for about 40 years. Today we're going to talk about the connection or the relation of vitamin D and diabetes. Vitamin D deficiency is very common in this country and probably all over the world. It is estimated in this country that 90% of people have vitamin D insufficiency, and about 50% of the people have vitamin D deficiency. The implication of vitamin D deficiency are several, and they are divided primarily in two groups. One is called a short-term implication, and the other one is called long-term implication. The short-term implication of vitamin D deficiency are fatigue, muscle ache or fibromyalgia, and depression. The long-term implication of vitamin D deficiency are more serious. There is increased risk for diabetes, type 1 and type 2. There is increased risk for cancer. There is increased risk for osteoporosis, and there is increased risk also for cardiovascular disease. Why do we have vitamin D deficiency? Especially if you live someplace like Florida, and we still see a lot of patients with vitamin D deficiency. There are several factors involved in the deficiency of vitamin D. First is insufficient intake. You don't take enough with your food. Second, lack of sun exposure. Third, you go out in the sun, but you put tons of sun blocks on you, so you don't get really any sun. Four is smog and pollution, which is very, very important factor in blocking the sun X-ray to come and interact with the skin to produce vitamin D. If you have a dark skin, that's why usually blacks are more subject to vitamin D deficiency than whites. If you are in a low-fat diet, which is very common, these days, especially among ladies, a lot of them are on a low-fat diet, and as you know, vitamin D is a fat-soluble vitamin, which means it does not absorb, it does not get to your bloodstream unless there is fat in your food. So if you are on a low-fat diet, even when you take a supplement or you take vitamin D in your food, it's not going to be absorbed very properly if you are on a low-fat diet. There is some other malabsorption issues that can cause vitamin D deficiency. These include cystic fibrosis, Crohn's disease, ulcerative colitis, celiac disease, gallbladder disease, short gut syndrome, and if you consume a lot of soy product in your diet, because soy usually will interfere with the absorption of vitamin D. Let's talk right now about the connection of vitamin D to diabetes. There is no question in my mind that vitamin D is involved or connected with both type of diabetes, type 1 and type 2. The involvement or the connection of vitamin D deficiency to vitamin D is related to something called insulin resistance. The connection to type 1 diabetes is related to what is called apoptosis of the beta cell, which means the death or the demise of the beta cells. What's about the insulin resistance issue that we see primarily involved in the mechanism of type 2 diabetes? The insulin resistance is an inflammation state associated with elevated cytokinase levels, which through oxidative stress will cause endothelial dysfunction. That's the lining of the arteries and veins in the body. Now, does vitamin D affect or connect it to inflammation? The answer is yes, because usually if you supplement with vitamin D, the marker for inflammation, such as high sensitivity, CRP, will decrease. And there is also the other factor, if you have endothelial dysfunction because of vitamin D deficiency, this will improve when you supplement with vitamin D, especially in patients with type 2 diabetes. Could vitamin D supplement decrease the epidemic of type 2 diabetes in this country? I would say the answer is yes. How? It will prevent type 2 diabetes by decreasing insulin resistance and by preventing the cardiovascular events by improving the endothelial function. Obesity is associated with low vitamin D level. This is a known fact for many, many years. And would vitamin D supplement in obese patients prevent the development of type 2 diabetes? I would say the answer is yes. Every obese patient or patient is at a high risk to develop diabetes type 2, and then he or she, if you are obese or overweight, you need to check your vitamin D level on a regular basis. Now let's talk about the relation of type 1 diabetes and vitamin D. Vitamin D deficiency will cause, as I mentioned, apoptosis of the beta cells. Apoptosis, it means the death, the demise, the destruction of the beta cells. These are the cells which produce insulin. How does this apoptosis takes place? There are three factors involved in the apoptosis or the demise of the beta cell. One is glucotoxicity, which means high level of blood glucose or blood sugar will damage the beta cells. Second is lipotoxicity, which means elevated cholesterol and triglycerides will damage or will kill the beta cells. And the third one is inflammation. The inflammation will damage and destroy the beta cell. Could vitamin D supplement decrease the epidemic of type 1 diabetes in this country and in the world? I would say the answer is yes. How? Because it will preserve the pancreatic beta cells. As you know, the beta cells have a lot of receptors for vitamin D. Second, it will improve insulin release because vitamin D deficiency is known to cause decrease in insulin release. And three, vitamin D will decrease the inflammation or the inflammatory process which can damage the beta cells. Thank you for watching. If you need more information concerning the subject, please visit our website at treolife.com. Thank you.